my own private clinic, which is Ayur Dental. And now today I am here to educate you about trauma in dental trauma in children. Okay, so what is trauma? Trauma is nothing but an injury. Okay, so yesterday when I announced the live, there was a question like, what is this dental trauma and how long does it last and all? Okay, so dental trauma is nothing but a dental injury. Okay, so dental injury is not the thing only which happens to your teeth. Okay, dental injury which is dental injury is usually defined as any injury that occurs to the lip, tongues, cheeks, and also the teeth. Okay, so it's a trauma of the oral cavity. Okay, and it can be to a simple lip cut to a complicated jaw fracture also. Okay, so first I would like to start with the soft tissue injuries. What are soft tissues? The soft tissues of the oral cavity are lips, gums, tongue, cheeks. Okay, all the soft these are all the soft tissues. Okay, so first what happens is children don't listen to us, and they run wherever they want, and they pick up whatever they need. Okay, so what happens is in this process, what happens is children usually hurt themselves. Okay, they hurt themselves, and many times recently my baby who is 1 year old, he also got a lip cut and also a cut on the gums, so which exposed his unerupted tooth. Okay, so this happens in many of the cases, and it is usually very common. And in India, usually in the foreign countries, walkers are banned. But in India, what happens is still the walkers are being sold. They are being marketed. Okay, so because of these, what happens? Walkers, what happens is, so we want in India everyone is very much competitive, and we want our children to achieve milestones earlier than other children. Okay, so what happens here is everyone what they does is they buy a walker, they put their baby in the walker, just they do their work and all. Okay, so the problem with these walkers is what pediatricians say is, so with walkers there is altered development of the hip bones and all. Okay, they say, but according to the dentist, what we say is, so you put the baby in a walker, baby gets access to all the areas inside our home. Okay, so he goes here and there, he walks here and there in that walker and all. He pulls out something. Okay, and he might injure himself, or he falls down from the walker and he might injure himself. Okay, so this usually happens between 9 to 12 months of age, this type of injuries. Okay, these walker injuries happen between 9 to 12 months of age. So for this I suggest not to buy a walker for your kids. Okay, so if you are so desperate to give a walker, just give a push walker, but not a walker in which the baby sits. Okay, so the walker injuries are mostly to the lips, to the front teeth, and sometimes, touch wood, it doesn't happen too much, but sometimes what happens is, so your baby's bones might also break. Rarely, this happens very rare. Okay, so what I suggest is do not use walkers. And uh, and of course boys are so mischievous than girls, and boys are the most affected with dental injuries than girls. Okay, and most common age where boys and girls both get affected and both get injuries are 2 to 3 years of age. Okay, so because in 2 to 3 years of age, babies are very active and they don't know fear yet. And what happens is they try to explore everything. Babies are explorers, so they try to explore everything. So when babies try to explore everything, happens accidents happen. So in that accidents, what happens is baby teeth may broke, or baby may cut their lip, or baby may fall on this happens, the tongue may fall between the front teeth, and baby may cut their tongue. So baby may uh, bite their cheeks and all. These all happens related to the dental injuries. And in permanent when baby get permanent teeth, the most common age when babies get injured is 9 to 10 years of age. And this type of injuries, and in this age group mostly boys are affected. Okay, mostly boys are injured in this. So going to the excuse me, going deep into the subject, first I would like to educate you about the first aid which has to be done for lip injuries, gum injuries, and cheek injuries, or if the baby bites his tongue by accident. Okay, so first I'll tell you that. Okay, so first let's discuss about the soft tissue injuries. So while playing, while climbing, or in sports activities, usually babies get injuries, and most of these injuries can be handled at home with a simple first aid. But first aid is necessary to stop any further complications. But after you do first aid also, you have to visit a doctor, a dentist. Okay, so you can see only what has happened outside. Okay, you don't see what has happened inside, what has happened to the bones, what has happened to the teeth and all. You don't see usually. So first I'll be speaking about the first aid part, and later I'll be coming to the teeth injuries. Okay, so when babies fall, they get so much of blood. Okay, even a small injury gives so much of blood, and we usually get panicked by that. So the first point in first aid is, when your baby gets an injury, you need not panic. Okay, you stay as cool as possible. Once if you panic, baby will think something has happened to me, and they'll get anxiety attacks, they'll get panic attacks and all. Okay, so first the parents should be very much patient. Okay, and you should be very cool. You should be a model for your kid. So you should not do like, ammo, something has happened to my baby, something has happened to my baby, and we should not cry. Yes, I accept that parents get emotional if baby gets any injury and all. Okay, but you should not panic. This is the first and basic key to first aid. Not this, any first aid, this is the basic key. Okay, so what happens is, this gum, tongues, lips, this all have a lot of vascular supply. Vascular supply is nothing but the blood supply. Okay, so what happens is, even a minor cut, what gives is, it bleeds a lot it bleeds. Okay, so when these cuts happen, they bleed a lot, but these injuries can heal very quickly. Okay, these injuries can heal very quickly, and these type of injuries need stitches very rarely. Okay, sutures are done very rarely for these type of minor injuries. So first what you do is, calm yourself, calm your child, apply pressure with a clean cloth or gauze for several minutes until the bleeding stops. Okay, usually the bleeding stops by 3 to 5 minutes, and in some children it may stop by 1.5 to 2 minutes also. Okay, so bleeding may completely stop by 3 to 5 minutes. Okay, but before starting the first aid, instead of panicking and being calm, first you should do is wash your hands properly. So we'll be touching this, that, and all in the home, and suddenly the baby falls, and we go and we put here. No, we are subjecting the wound to several microbes. Okay, to several microorganisms. We are subjecting the wound. Okay, so that means we are giving another infection from the external environment. Okay, so never do that. First wash your hands properly, and then approach your child. And these injuries may happen either inside the mouth or outside the mouth. Okay, they may happen here or inside the mouth. Okay, so first let's see about how to handle the cuts on lips or outside the mouth region. Okay, so first wash the wound well with water. Okay, never scrub the wound. Okay, you should not scrub the wound. Remove any dirt particles from that area. Okay, and let it run over water for few minutes. And don't forget that you should wash your hands before doing that, as I've already mentioned. Okay, and a dirty cut or scrape that is not well cleaned, that can cause further infections and further scarring. Okay, so be sure, and give your child an ice pop or an ice cube or something, so that the baby sucks on that. If it happens on lips, give something cold, not like frozen ice cubes. You can give that, but not for too many minutes. Okay, so give your child, so that your child puts it here. If the, for example, if the cut happens on the lip, okay, if that happens here, give your baby an ice cube, let them suck. Okay, what happens is, with the cold application, the bleeding will stop, and the baby will also feel better. Okay, so if any swelling is also there also, you have to put something cold compress. Okay, never put a warm compress on a swelling or on an injury. Okay, so if you put a warm compress, it will dilate the blood vessels. Okay, it will open the blood vessels more, and what happens, bleeding will be more. Okay, and if you keep it on a swelling already it's an inflamed area. So what is inflammation is, we will see redness and a rise of temperature in the particular area where the wound has happened. Okay, so when it is already inflamed and you give an external stimulus of hot water application or something hot application with a cloth, what happens is, so it will get irritated more and it will become more red. Okay, and the most important thing you have to follow is, what we do is, okay, our finger cuts, what we do is we blow on the wound, we'll suck the wound. Okay, so when injury occurs on the baby's lip, a cut is seen on the baby's lip. Okay, so what happens, you should not blow the wound. Okay, because our mouth has several microorganisms, too many of microorganisms. Okay, so if you blow the wound, what you'll be doing is, you'll be exposing the baby to more number of microorganisms, so which you should not do. And remember that whatever I say, whatever I tell you now is just the first aid part and it is not the treatment part. Okay. So ultimately, you have to visit a dentist for the treatment. Okay. So now we have discussed about the soft tissue injuries inside the mouth. Outside the mouth. So what if a wound happens inside the mouth? Okay. So we'll see it now. So because the area is inside the mouth, so yeah, you have to make the baby rinse with cool water for several minutes. Remove the dirt particles from that area. Give your child an ice pop or ice cube. Never put a hot compress. This is really very much important. Okay, never put a hot compress on any injury. So even a small injury, if it happens on the border of the lips, no, it will look like awkward, but these wounds will heal. Okay, because children have a very good repair system. So this is regeneration and repair. When a wound happens, when a wound occurs, what happens is regeneration and repair. Okay, then the repair system of children is very very good. Okay, so these wounds do not need stitches or sutures, as I already mentioned, and these will heal by on their own, and there is a very rare chance for scarring of these wounds. Okay, so cuts can happen even in the corner of the mouth. Okay, these also will have very severe bleeding. So cuts inside the mouth, what happens is, they also bleed much, but these also rarely need stitches. But in some cases you need to stitch the you need stitches, you need sutures for that. Okay, and visit the dentist as soon as possible. So after every category I'll be saying this only: visit the dentist as soon as possible, because first aid is just to stop the further complications and it is not the ultimate treatment. Okay, so when should you get immediate medical attention? Okay, so you can do first aid in these cases, and you can wait for 1 or 2 hours to go to the dentist and all. So in some cases you have to visit the dentist immediately. So when should you visit a dentist immediately is, first thing, when the bleeding does not stop even after 5 to 10 minutes of pressure application. Okay, this is really very important. When the cut is deep, okay, when the cut is deep, or it is longer than a half inch. Okay, half inch is like this much. Okay, when it is when the cut is more than a half inch, or when it is very much deep, you should not neglect and you should visit the dentist immediately after the first aid you do. Okay, and the cut is very large and is on the face. Okay, and it is excuse me, it is caused by a puncture wound, or it is caused by a rusty object. Okay, any rusty or contaminated object. And if the wound is embedded with, so sometimes what happens is, babies fall on the ground or fall on the dirty area. Okay, so then the wound gets contaminated with debris, dirt, stones and all. Okay, in that case also you have to immediately visit the dentist. And when the wound has separated edges, like when it appears like an open wound. Okay, when the wounds are separated, when the edges are separated, you have to visit a dentist immediately. And if the wound is caused by a human or animal bite, okay, this is also very much important. You have to visit a dentist immediately. And the next thing is, this is a bit complicated. Okay, so if the baby feels extremely painful, or if you suspect a bone injury, okay, or if you suspect a bone injury here near the zygomatic bone or in the mandible and all. So these are medical terms. Okay, I'll simplify that. if you suspect near the cheeks, this cheekbone or the jawbone, lower jaw or upper jaw, then you have to visit your dentist immediately. And if the baby shows any signs of infection soon after 10 to 15 minutes after delivery also, and you have to get not only the dentist, but you have to visit a pediatrician when your child has not a tetanus shot within the past 5 years. So this is for like some elder children, okay? For the past 5 years, if your child has not got a tetanus shot, you have to visit a pediatrician and discuss with him, okay? So this is regarding the basic first aid, and regarding the injuries outside and inside of the mouth, the soft tissues, okay? So now speaking about the hard tissue injuries, the mouth, it has, so what do we think of oral cavity? So when I've announced this live also, many of you have thought dental trauma in children means I'll be discussing only about the teeth, okay? So it's not only about the teeth, it's about all the oral cavity and also face, head and face, okay? So now coming to the teeth part, okay? So we have two sets of teeth. One is the milk teeth and one is the permanent teeth. So milk teeth will, permanent teeth will start coming from 6 years of age. So till 6 years of age, what we'll be having is, we'll be having only milk teeth, and injuries may happen also to milk teeth. And in milk teeth or permanent teeth, mostly injuries happen to only front area, because usually child falls on the front area, so that happens to the front area. So now let's discuss about this. So tooth has three parts, okay? First one is the white thing you're seeing when I'm talking is the enamel, and the layer which is below the enamel is called the dentin, and the layer which is below the dentin is called pulp, which has nerves, food supply for the tooth and all, okay? So thing here is, when any injury happens to the enamel, any chipping off and all ragged edges, okay? So for primary teeth, we can leave like that, okay? But if any fracture in the enamel, no, we have to get it filled by the dentist, okay? So this is for both primary and permanent teeth. So what if the dentin involves, like the underlying layer of the second layer of the tooth involves? So what we have to do is, we have to visit a dentist, and your dentist puts a filling on that. And what if the injury happens to the underlying the third most layer, which is the pulp, which has nerves and food supply for the tooth, which gives food supply for the tooth is, you have to visit a dentist, and your dentist will perform a root canal treatment or extraction based on seeing the x-ray, okay? Without seeing an x-ray, we can't tell anything, because we have to evaluate whether there is a root fracture also inside the bone, whether there is a root fracture also, okay? So what happens is, so your tooth, half of your tooth breaks, okay, and it comes off, the toothpaste comes off, and what usually parents do is, they throw away the toothpaste, okay? So for example, if someone's fingers cut, okay, finger gets cut, okay, what will you do? Your you will cleanly pick up the finger, put it in a cover or something, or keep it clean and take to the orthopedician, and you'll say, so my finger has got cut, please stick it to the remaining finger, okay? I don't want an artificial finger, if it is possible to stick the finger to this, okay? And the doctor will do that, okay? But in case of tooth, what we'll do is, what parents do is, usually they throw off the tooth, thinking that it's useless and it's not important. But we can, okay? But we can reimplant it, okay? Sorry, it's not reimplantation. We can stick it to the remaining tooth which is present in the oral cavity, okay? We can do it, okay? And when the tooth comes, we call this knocked out tooth, okay? When the knocked out tooth, when the full tooth comes out also, few parents, what they do is, they leave the tooth there itself. No, we should not do like that, okay? What we have to do is, we have to pick up the tooth, we have to clean it, okay? You should not wipe with a cloth, okay? So for knocked out tooth, what you should do is, you have to pick up the tooth, you have to clean the tooth under with clean water, okay? But you should never wipe the tooth with a cloth, okay? If you wipe the tooth with cloth, what happens is, you will be removing all the useful layers on the tooth, okay? Any periodontal tissues and all, uh, you'll be cleaning that all. So you should not do that. And when your baby's tooth knocks out, you should visit a dentist within 20 to 60 minutes with the tooth, okay? And I'll tell you some important media in which the tooth can be kept is, first thing is saliva, okay? You can take the tooth, you can store it here in the buccal area, okay? You can store it in the baby's mouth and you can take him to the dentist, or you can put that in the tender coconut water, and you can put that also in lens solution. You have lens solution, no, but lens solution, no, but approach the dentist 20 minutes within 20 minutes, okay? And you should never put that in tap water, okay? You should never put the tooth in tap water. And um, some other are, you can put that in milk, okay? Milk is really a very good medium, but never ever put that in tap water, okay? And you can put it in saline solution also, but not for long time, okay? So these are the storage types which we can do. And when you take a tooth fragment which is lost, uh, and your dentist will reattach it if possible, okay, if possible. And so this knocking out of tooth means the total tooth structure coming out may occur both in the milk teeth and permanent teeth. So in milk teeth, what the dentist does is, we need not reimplant, okay? And in permanent teeth we can reimplant if possible. And the important thing is, when injuries happen to the milk tooth, many of the parents neglect that, okay? Many of the parents neglect that, and what they do is, they just leave like that, okay? So what types of injuries we I'll just speak about types of injuries for 3 to 4 minutes, and I'll end this session, okay? So types of injuries may what type of injuries may happen is, your tooth may get displaced, okay? So my tooth is like this, okay? So it may displace inside, or it may get elevated, or it may go inside, or it may come outside, okay? It may get displaced in any of the four directions. So uh, think that a baby has fallen with impact on his front teeth on the floor, and his teeth went inside, okay? And the baby is fine playing after 1 hour and all, and you're not concerned to take your baby to a dentist. But what happens is, so beneath the milk teeth, you have permanent teeth, okay? So this impact, which is on this milk teeth, which happened on this milk teeth, may directly impact the permanent tooth bud. Okay, so then what happens is, your tooth bud will stop growing in some cases, and after this milk teeth shuds also, it won't the permanent tooth won't come off for years, okay? Because it stops its development, or it gets impacted inside the bone itself. So you have to visit a dentist even it is a minor injury, okay? So if we neglect it, it's a lifetime punishment for the baby, because imagine not having a permanent front tooth, okay? Your baby gets trolled, your baby gets mocked by the peer group and all, okay? So that's why it's really very much important to visit a dentist, even if you offer a first aid, and even if the baby is not in pain, or even if the baby is very active, okay? And I've missed a point which is really very important. So if your baby falls, any on head, or any injury happens, you have to take your baby immediately to the pediatrician. When your baby cries non-stop, your baby has bleeding from ear, or your baby vomits after the injury, okay? This is really very much important, okay? So this may happen even in the case of dental injuries. So the impact may also be on the head sometimes, not because of the teeth, but even this is generally when your baby falls, okay? So that's why baby teeth are very important, and visiting a dentist is also very much important. I'm sorry. And also visiting a dentist is very much important, okay? So I've spoken what all I've thought to educate you, and if you have any questions, please let me know so that I'll answer. We have 6 more minutes for the live session, so I'll answer all your doubts, okay? What if my child is having cold and cough and it's winter weather? Should I go for cold compress? So then you can avoid, okay? So in such cases, you can avoid. What you do is, you just take a sterilized cotton or sterilized cloth, and just wet it, okay? Just wet it with not tap water, okay? Just wet it with hot water, but don't put the hot cloth on your baby, okay? Let it cool, and you apply it, okay? You can avoid the cold compresses. I've already mentioned that you should not so there is not rule that you should apply directly ice cube or freezing cold things, okay? Just you can keep a normal temperature cloth also. So here is another question: what are the possible consequences of any traumatic injury to the tooth? Yes, I've already discussed this. Okay, the possible consequences is your permanent teeth get affected. Okay, your permanent teeth which baby has not got, okay, that may get affected. And in the permanent teeth, what happens is, uh, so uh, so let's imagine the baby is 7 years of age, and his upper front tooth has come, and he fell on that and it broke. Okay, what happens is, you may see the root completely, you may see the crown part completely, but the root is not completely formed. What happens is, the tooth growth stops inside the bone itself. Okay, inside the bone itself the root growth stops. Okay, and it's a complication in the further future, so it may lead to any abscess or cyst and all. Okay, so this does not happen overnight, this happens for years long. Okay, and when by the time we realized, all the damage might have happened. So that's why you have to visit a dentist. So these are the possible consequences. Do traumatic dental injuries differ in children? Yes, yes, traumatic dental injuries differ in children. It depends on the impact. Okay, not every child may get affected with only central incisors or this one. Okay, some may get affected with the lower teeth also. And yes, I've already discussed this. There are different type of dental injuries, traumatic dental injuries. So, if a baby falls, so I have an example. Okay, so my brother, he fell from first floor. Okay, when he was 1 year old. But what happened is, there was not even a single fracture or single thing, but a small cut near the chin. Okay, that's what I have told now. Traumatic dental injuries differ. It may be from a simple cut to a complicated jaw fracture. Okay, so this way the dental injuries differ. So the next question is, how safe are dental x-rays? See, if dental x-rays are harmful, it's harmful to us because we get exposed daily several times. Okay, and when you come, we just take one or two x-rays, and it is not that dangerous. Okay, the dentist will provide you with a protective equipment. So uh, so I have to answer this question much elaborately. So you have to inform your dentist if you're having thyroid or any bone related diseases and all. You have to inform to your dentist even if you're pregnant. Okay, so that will give the protective equipment, and if you're pregnant, we'll avoid x-rays in few trimesters. Okay, and this is another different uh, a subject to discuss with. So dental x-rays are safe. Okay, they don't have too much of radiation and all. Okay, uh, and uh, um, and when we expose the patient to an x-ray, we expose depending on the tooth we take, on either front tooth or back tooth. And it also differs if we are taking on a child or adult. In child, the exposure will be very less. And in adult, the exposure will be little more than, oh sorry, what we give for a child. And it's not at all harmful. Okay, what is the best toothbrush for kids 1 to 5? Do you recommend the Sonic? Yes. So I'll discuss the what is the best toothbrush for 1 to 5 in another life, because this is also a very elaborated topic, and I would not recommend any toothbrush brand. Okay, what I suggest is, you have to see the handle of the toothbrush and the bristles of the toothbrush and the head of the toothbrush before buying for your baby. And this is all available on my Instagram account, which is Indian Dentist Mom. Okay, you can check out there. And according to the ethics part of dentistry, we should not recommend any toothbrush or toothpaste brand on a public stage. Okay, do you recommend Sonic toothbrushes? Yeah, I recommend that. Okay, but what happens is, if you give the child an electric toothbrush from the first year itself, when you introduce a toothbrush, so how does a baby learn the correct brushing technique and how to make the movements and all? Okay, I recommend, but I vote for manual toothbrushes in the initial days. Okay, so Sonic toothbrushes, mothers can brush their baby's teeth with that. Okay, how can parents help prevent tooth decay? Oh, if I speak about this, it will be another 1 to 2 hours lecture. Okay, so uh, I'll just give a short on this. So never put your baby to sleep with a bottle, and after meals, just offer a sip of water for your baby just to wash off the contents, wash off the debris. So what happens is babies below 3 years can't gargle or can't spit. Okay, so what you do is just a sip of water. It's enough. Just 5 to 10 ml is enough. Okay, so that is the basic tips, and we'll discuss this again. How long does it take for a traumatized tooth to heal? It depends. Okay. So usually, what we do is when a tooth is mobile and the next tooth is stiff, it's firm. What we do is we do splinting. We just attach the mobile tooth to the next firm tooth with a wire. Okay, and what we do is we just leave it on for 1 week to 14 days. Okay, depends. It depends on how much the tooth is mobile. If it's mobile for zero point 0.5 millimeter or 1 millimeter or 1.5 millimeter, or it's too much mobile. Okay, so depends on that. And it also depends on the lip lacerations, how much deep it has get and all. Okay, so don't you need not worry, because baby's teeth heal. Baby's teeth and injuries, they heal very quickly compared to us. Okay, all we have to do is we have to give proper care to the child. We have to treat the child with tender love, care. Okay, we have to be cool first. Okay, we should not cry when our baby falls down and all. Okay, so I think I've answered all the questions and all, and I'm really thankful for everyone who has attended this live. And I would like to summarize. Okay, the summary is, you have to do a first aid. Before the first aid, you have to be very cool, and you have to calm the child, because the child will be the child will be in shock. Okay, so you have to calm the child, you have to be cool. You should wash your hands before doing any first aid or touching the child's wound. Okay, so if you think it is complicated, you have to visit the dentist as soon as possible. You should not do it late. And the knocked out tooth can be reimplanted, and the tooth which are cut to half also can be reattached to the remaining part of the tooth and all. Okay, so keep all these things in mind. Okay, so hope no child gets a traumatic dental injury, but we have to be careful. We have to be careful with our children, and we have to be ready to react when our child gets an injury. Okay, so I would like to end this live session with this, and I would like to thank everyone for attending me, and for everyone who has asked several questions. But some questions to discuss here are very large, and we'll do another live on this. Okay, thank you so much. I think it's helpful, and thank you. Have a good day.